Hi, I'm Dr. Harbir Singh, live here at the Digital Health Summit studio here at CES 2020. We're here today with Jeroen Tas, Chief Innovation and Strategy Officer at Philips. Jeroen, it's a pleasure to have you.
Pleasure to be here.
Yeah. So tell us a little bit about what Philips is doing in the healthcare space, in the digital health space.
Well, first and foremost, a couple of years back we decided to become a health technology company with a mission to improve the health of 3 billion people by 2030.
Okay.
So instead of being a technology company looking for application, we said we're going to hone in on technology that helps consumers take better control of their own health and professionals to provide better diagnosis, better treatment, and better support of their patients, and bringing that together is our mission.
That's fantastic, and I love the fact that the mission is so meaning and outcome oriented, impacting 3 billion people, right?
Yeah.
Yeah, that's beautiful.
And we still have some ways to go. We're reaching 2.1 billion, but we're clearly looking at also specifically at people who don't have access to care today, and can we leverage technology to bring care to wherever they are. And some people have to travel, hours or days to get just basic health care. So that's also part of our mission.
Wow, so can you explain to us in some more detailed examples of what that means and how that translates into everyday life, everyday consumer life?
Yeah, absolutely. So, just take sleep.
Okay.
And we all know sleep is really important. It restores your body, your brain. But 60% of the adults have issues with sleep, and I'm not even talking about young kids that even have bigger issues. But some of these issues may be clinical and some of them may be behavioral. So we set out, based on our franchise in sleep apnea, to really deeply understand sleep and how we can guide people to better sleep. So if you come to our booth, you'll actually see clinical devices like a CPAP that helps you with air circulation, a device that avoids snoring. But I think our more exciting proposition is a sleep band.
Okay.
And that band has 3 sensors that does an EEG. So it understands your electric working of your brain. It knows when you go into deep sleep. It senses when you go into deep sleep. It will then trigger a set of sounds, and it will actually know when you fire off your neurons, and it will just give it a little bit push. And it means you stimulate your deep sleep, even with short sleep. Now you can wake up refreshed. But importantly, we're also using AI in a dialogue with you, to figure out how can we guide you to better sleep. And if it's a clinical issue, we connect you with a clinical provider. It's just one example.
Wow, yeah, that's fascinating. So you're doing something that's unique in the sense that you're taking information, but also giving feedback. You're taking information about brainwaves and then encouraging sleep, which is very different than what's traditionally been happening.
Yeah, and I can talk about some other applications you see here. So, for instance, you're talking about real life, and to me, there are important moments in your life. And one of the most important is when you find out your wife is pregnant and you get a new child. But pregnancy is a difficult period, As a mother or as a couple, you really want the pregnancy to go really well. And there's a lot of anxiety involved. So we have an app called Pregnancy Plus that's guiding millions and millions of mothers towards a better pregnancy, and we will ultimately look for signs that say, hey, you need help here.
Yeah.
But then your child is born, and of course everybody knows the first 100 days are hugely important. So again, how can we help you and guide you through these days to help you, raise a beautiful kid?
That's fantastic. Now, Jeroen, I've got a very interesting question. You've got an interesting background. So you're a technologist by background.
Yes, I am.
Right? And you had originally worked in the banking industry and helping bring technology into banking. So what and the theme this year at the Digital Health Summit has been talking about, the intersection of digital health, and technology, and just healthcare in general. So what are the parallels that you're seeing now compared to what you had seen as the banking industry underwent a technological revolution?
So in the mid-90s, I was running Citibank's tech lab in California, and we were the first to launch internet banking. And the whole idea was giving people self-service, giving them insights in their financials. At the back of it, we also did a lot of analytics. So we stratified our consumers into different needs and then tuned the products to the needs. Now that's what's happening in healthcare as well, because we want to understand, payers, providers want to understand their patients. They want to stratify those patients according to their clinical needs, but also increasing their behavioral needs, because health is not about you having a disease, or for instance my daughter has type 1 diabetes, and that's a clinical condition, but it's a condition with a lot of complications, and there's a lot of behavioral aspects, how you eat, stress, how you sleep, anxiety. It will all influences how the disease expresses itself. So if we can apply the same approaches to understanding your needs, tuning the services of a hospital, of a health insurer towards those needs, getting deep insights that can guide you towards better outcomes, I think that's hugely important and that's badly needed in healthcare.
Oh, absolutely. So how are we seeing those sorts of things happening right now?
Well, it's interesting. I was just on a panel with a colleague in Humana, one of our big payers in the US, and they have a similar philosophy as we have. How can we help consumers, or they talk about their members? How can we better understand them? How can we give them a personalized approach to their own health? If they are high risk, and for instance they have multiple chronic diseases, how can we give them the tools to better understand their condition, but also remotely monitor them, so that when we see that there is now high risk of deterioration, we can intervene and maybe send a nurse to their home, or do a two-way video session where we engage them into, a change of their behavior towards better health. That it can be hugely impactful. We've seen that patients with multiple chronic diseases and complex medication, if you guide them, if you support them remotely through technology, you can reduce emergency care by 60% and readmission to the hospital by 50%. That's big for everybody. It's big for the payer, it's definitely big for the patient, because it keeps them healthy and out of the hospital.
Absolutely. I mean, the things that you've brought up are challenging and addressing some of the biggest issues in healthcare that we're facing today, especially in the United States. So I'm very excited to see what Philips does in the future, and excited to see how the products impact consumers as well as the larger healthcare landscape. So thank you.
We would love to have everybody visit our booth and get a feel of how we can help their lives become healthier. Thanks so much for having me.
Yeah, thanks so much. This is Dr. Harbir Singh live at the Digital Health Summit studio here at CES 2020.